I look good. Everybody looks good.
Good thing you can't see us from the waist down.
Oh, because I clearly have on basketball shorts, the waist down.
I have my Minnie and Mickey Mouse pajama bottoms on.
That's the way you're supposed to go, man.
Yeah.
We are live, actually. I am habitually the first person to like it because why not? So it is 10:05. We will get started probably in 1 minute. So when my clock says 10:06, we'll get started. We are live, just so everybody knows that we're live, and we have good sound. If you guys want to take a second and share it on your own personal Facebook, you're more than welcome to. But you do not have to. Just always giving that as an option for you guys if that's something that you want to do. Edwina's watching. I just got her notification that she liked our video.
Who's watching? Edwina.
Edwina.
Yeah. So
Edwina, we love you.
Yeah, everyone always
volunteer and she do one of our shows with us.
Okay.
Everyone always loves a really good shout out, so I'm sure she'll love it.
She is a bright, beautiful spirit. We are lucky to have her as part of our work.
Man, we got it seems like we got a good group here, man. Let's just go ahead and jump in. I was trying to pin all of our contact information in the comment section here. I'll go ahead and do that really quickly. But man, let's go ahead and get this party going. I'm excited. We got a bunch of good folks. Edwina, we love you too. We see you in the comment section. We are excited again to be with you guys. Miss Brenda, I think I told you this when we spoke yesterday. I think I'm relatively excited about all these things we do. But today we're excited because we have Miss Brenda from MercyCare with us today, and we're going to be really diving in and discussing the impact of domestic violence on a person's health. And so I think some things are probably fairly obvious, but we want to dive a little bit deeper today. And instead of just talking about kind of the surface level impacts of health, we want to really bring you a little bit more detail. And so we're excited to have Miss Brenda from MercyCare with us today. So we're going to go around the room like we always do. Miss Brenda, take it away, man. Tell us a little bit about yourself, and then what do you do for MercyCare?
Okay, so I have the privilege of working with MercyCare. I'm the Director of Behavioral Health and Social Services here. And MercyCare is a federally qualified healthcare center, very active here in the metro region. We have, as a federally qualified healthcare center, we offer primary care, behavioral health care, integrated behavioral health care, dentistry, vision, pediatrics, different other services dependent upon specialty and volunteers, because we also have volunteer physicians and other healthcare folks. We also have some very unique programs such as street medicine, that primary care, psychiatry, case management actually goes out into the street. That was one of the very original services of MercyCare, and has maintained all of these years from when we were part of St. Joseph's healthcare system exclusively. We have recuperative care units, two of those, one for men, one for women. These are for homeless people who have been in a hospital. They're being discharged from a hospital, but there's no way that they could really exist very, very vulnerable on the streets. So we can provide a case management unit for them for 30 to 45 days to help them get situated. We have HIV care. We have some dermatology. We just have lots of programs to help with chronic illness. So that's pretty much in a capsule. We're a Catholic healthcare organization. Many people who work here are not Catholic, but just the very strong mission, of reverence and working with every individual is really foremost in our minds, and we're pretty passionate about everything that we do. We're also a healthcare center for the homeless. So we work very closely with that group of folks, and we also treat all other insurances and people who are uninsured. And we see you as a great partner, and appreciate being part of the partnership in general, and then today.
Yeah, man. What I love is I think I share this with all of you guys at one time or another, is these things are so informative for me. So I know our guests that are watching us every day or whenever we do these are learning a lot, because personally I'm learning a lot, and I didn't know that MercyCare covered the breadth of services that they covered. So it's just really exciting to see that you guys really being out there and being an asset to the community as a whole, and not just the homeless population. So Miss Sam, you are a regular, world famous Samantha Macedo. Please tell us who you are and what you do for Partnership Against Domestic Violence.
Hi, everyone. Again, my name is Samantha Macedo. I am the Vice President of Prevention and Outreach for PADV, and I get to work with in outreach with a lot of the great partners and other organizations, as well as bringing awareness, education, and prevention to our community.
Well, thank you. And I also want to, before I go to Nancy, I do want to make sure I say hi to Sam's dad, because I'm sure he is one of the people watching today. Probably the most supportive dad on the planet, because he's always first to like our stuff when Sam's on it, and he's always first to share it. So, hey, Sam's dad. And finally, Miss Nancy Freehoff, she's our CEO. Nancy, you are a fearless leader. Take it away. Tell us what you do. And yeah.
So I'm Nancy, and I'm the CEO of Partnership Against Domestic Violence. And what that means is that I have the honor and privilege of working with an incredible team of staff that is tremendously dedicated and committed to our mission of ending the crime of intimate partner violence and empowering its survivors. That's what I do.
That's awesome, man. So I'm just going to jump in here, because we got a good group of people watching with us today, and I'm obviously excited, and I'll say that a lot. But I do want to make sure, before I ask the first question, and Sam, the first question is going to come to you. But I do want to make sure that everybody knows, as we kind of round this conversation, at any point, if those who are watching today, if there's something that you want to ask in the comments, just please drop your question in the comment section. That's what this is for. It's not for us to sit here and talk to each other, but it's really for us to engage with you, the audience, and answer the questions specifically that you have. So we would love to engage with you that way. So Sam, first question that I have, how do the two agencies, how does Partnership Against Domestic Violence and how does MercyCare, how do we work together? How do the agencies work together?
So we've been working together for a few years now. We're very lucky to have MercyCare as a partner. We're able to refer a lot of our clients to their services, not just for general checkups, but the behavioral services that they offer, and dental services. So we're very lucky to have them as a resource for our clients who are living in our shelters, or really are not able to have access to healthcare, as well as we do offer classes to some other audiences. And so we do that in Spanish. We've done that in English as well, more regularly in Spanish. We go out to their audiences and staff and provide information about domestic violence, the patterns, what does it look like, and other resources. So we provide some community education in their at their locations.
Cool, thanks. And Miss Brenda, why is this partnership specifically so important to survivors?
Okay, because this is really not only are people in danger, and it's a safety issue, but this is really a whole health issue. There's been a lot of research in trauma, a lot of research in adverse early childhood experiences, where it's become self-evident that in undergoing these experiences, the actual reaction or responsiveness of the body, where there is a longitudinal development of chronic health disorders. So, for MercyCare to be able to provide essentially a multi-system approach, it's truly integrated health and integrated behavioral health. Because if you think about it, depression, anxiety, it's not just in the brain. It impacts, the entire physiology. And living either constantly or intermittently in situations where a variety of things are threatened or injured, or fear is constant. We see this a lot of the time. So we have valued not only the referrals from your organization, but our ability to refer to your organization.
So it's really a two-way street of referrals going back and forth, because it goes back to what you said before. It's this whole community-wide effort to kind of end domestic violence. Nancy and Miss Brenda talked about kind of some of the health implications, and I'd like Nancy, to dive in a little bit deeper. And Miss Brenda, when we spoke yesterday, you said that you want to kind of dive into this next question as well. And so I would love for both of you guys just to take a few moments to talk about what are the health implications of domestic violence. That's really what we're here to talk about today.
Well, I think Brenda did a great job giving an overview of that. And the reality is the health implications are huge, both mental health and physical health. Health can be another way that the abuser works to get power and control over the victim. And I generally will use, when speaking about the perpetrator, use the pronoun he. We know about 15% of victims are men and 85% are women. But the abuser could deny medical care to the victim, could minimize physical complaints and concerns. Sam and I have looked at some issues such as chronic illnesses, such as diabetes and high blood pressure, and heart problems, where the victim may be experiencing symptoms and need to go and get screening and medical care. But the abuser will say, oh, no, you're fine. Just make a big deal out of everything. Get over yourself. And so, as we all know, when these chronic conditions aren't looked at, diagnosed, and treated, they can have a huge impact on the physical health and the longevity and the life of a survivor. The effects on mental health are tremendous. We sometimes hear the myth, well, it's just that victims have low self-esteem or have mental health issues, and that's why they are in these abusive relationships and why they don't leave. And we know that that's not true. That many victims go into the relationship healthy, self-assured business women, very functional in the community. But when you live in a situation where every day you're told how stupid and worthless and ridiculous you are, and how you can't do anything right, and how if you didn't have me, you wouldn't be able to function, you start to lose your self-esteem, and you start to feel very, as again Brenda said, very anxious and very depressed. And it's hard, you know, we say when people come to the shelter, it's like they've lost themselves. And so it's putting together back the pieces and helping them find themselves. And we can do some of that at our shelters and through our support groups. We can do some of that, but sometimes the mental health issues are such that they require more intervention. They may require medication. Some of the people coming to us may have mental health issues outside of the abuse. You know, abuse happens to everyone, so it can certainly happen to someone who may have already been struggling with depression or with a mental health issue. And that's, again, another thing abusers can do is deny that person with mental health issues their medication or access to their medication, so their mental health gets worse. So the ability to have that resource of MercyCare where they can comprehensively look at all the health implications, the mental health and the physical health, and put that together in one package and look at how to treat the whole person, that's incredibly important to the people that we serve.
That's awesome. Brenda, anything to add there?
I would just say that the ability to go ahead and start to work with somebody once you're referring them through a safe house, you know, helps us maybe open the door to their health. And then this really is, this is more than an episodic, you know, treatment for people, because they live in that contained atmosphere that is abusive. And, you know, we see women who not only walk in and they end up sharing this with us, or through referral, or even when we do our work at the City of Refuge, working with lots of women who are homeless because they have lived in a domestic violence situation. Many of them then go on to be sexually exploited. So, you know, this progression, you know, some people will think, oh, he hit me once, you know, or there's this line of verbal abuse that really can progress, that then there are long-term functional, maybe you're injured, but you don't realize how badly injured you are. You know, maybe you have a eye injury, but you don't realize how down the line, you know, that's going to be worse. So I think the interruption is really important with, you know, the reaching out to others and the assistance to promote the highest level of health and recovery, and then health and healing that's possible.
That's both of you guys, you know, literally just took the answer to a whole new level for me. One of the things I learned yesterday from Brenda was that that MercyCare, and obviously she said it earlier today, has a very active and thriving kid, what's the kid doctor one? What's that one called?
Pediatrics.
Pediatric, thank you. I have a kid and I'm like, shouldn't I know that, right? And so I say that because, you know, so many of our kids, so many of our women that come to shelter also have children. And so we have, every year we service in shelter alone 550 people, give or take, and over half of those are kids. And so the idea for me or as a leader in the organization, to say, cool, here's this great partner that can see not only mom and help her get on the right track, health-wise, mentally, but then also here we can get the kids seen by a doctor, and, you know, get them seen by a dentist and get some mental health stuff done all in one place is super impactful. And so that's why I'm always in love with this partnership, because it just allows us to, in one fell swoop, have everything that a survivor needs to really get back on track and get that road to recovery going.
Jeffrey, let me just say one thing about that. When you're in a crisis situation, so a woman who's being abused is in a crisis situation, your vision becomes very narrow and you're only able to deal with that immediate crisis that you're experiencing. So it's not unusual for us to see women coming into the shelter with their children, and they're so focused on their crisis and their trauma that it's very difficult for them to understand what's going on with their children, and why are their children acting out, and why is this 3-year-old that was potty trained wetting the bed every night, and why are they having nightmares. And so again, and maybe having health problems, or maybe they're starting to show anxiety, or they're not eating, or they're eating too much. Anyway, for us to have a partner like MercyCare, as you said, that can treat the whole family, and that can then talk to mom and say, this is what's going on. This is what's going on with you. This is what's going on with your child. And let's look at how we work with you as a family to heal you as a family and help you move forward. That's incredibly, incredibly valuable.
And we see it
just
very,
love...
and
No, go ahead, Ms. Brenda.
And we see it just thinking about what we talked about before, the adverse childhood experiences. Here, there are children actually, living what we're talking about, that the mom has been living. And so, the intervention and making sure that the child is having everything from, their vaccines, dental, vision. A lot of times those are neglected either because of, lack of money, lack of prioritization, in a household where whoever is the aggressor is the one prioritized. So, we have developed through this partnership with CHOA, we have pediatricians and advanced practice nurses. We have a child and adolescent psychiatrist and therapists. And we as an organization have spent a lot of time over the past couple of years becoming a very trauma-informed system of care. And that honestly is a big mouthful. A lot of people talk about it. We live it. And part of that is to assure that whatever you're doing is going to promote resiliency, because there's so much hope if people reach out and they connect and they get consultation, they get care to help that pillow of resiliency, to carry them into the next successful phase of their life, next successful phase of relationships, and having the appropriate health care and having an integrated approach is really necessary for that, building on what you said, Nancy.
Man, I'm telling you, you guys got me so fired up, man, because this is what partnerships are supposed to be, right? Like our mission is to end the crime of intimate partner violence, but it has nothing to do with it's not necessarily the healthcare side, right? And so instead of us saying, hey, let's take on that added cost and let's take on something that probably pulls us away from mission, right? Here we are having another organization in the community whose sole mission is to heal the whole person. And let's partner with them and let's create this magical alliance that takes over the world. So I'm all excited about that. Hey, Ms. Jennifer Thomas, I see you in the comment section. We just appreciate you for watching. So yes, we're highlighting this great resource, but we appreciate you today for watching us. So Sam, you've been really quiet, very un-Sam-like today. And I know your family's watching us. So let's throw something at Sam. Sam, could you talk to us about how important a survivor support system is to their recovery through this process?
Okay, can you repeat the question?
Yes, I can. So I wanted to just talk really quickly about how important a survivor's support system is to their recovery from this process.
Right. So so the one thing that we wanted to highlight with this talk today is I think a lot of people still think of domestic violence as someone's private problems, because the nature of it, sometimes it's a secret, sometimes it's happening behind closed doors. But the conversation here today is just bringing light to the fact that it's very domestic violence and that person's health is they're very connected, and there are short-term and long-term effects, not just as Nancy mentioned and Brenda has been talking about physical health, but mental health and risky behaviors. And part of that domestic violence experience is that isolation. As Nancy mentioned earlier, the abuser may have not allowed, control the transportation, not allowed the survivor and their children to go to doctor's appointments, not receive the care that they needed as a result, issues that had been building up, physical health issues, mental health issues have been building up. And so when they come to Partnership Against Domestic Violence, we are trying to rebuild that a network of support, a network of response, that based on what the survivor needs. So yes, the survivor may need assistance with, like Brenda mentioned, getting the kids vaccinated because they haven't received vaccinations in a while, understanding what's going on with the development and the status of the children's health. So all of that forms that support network, that support system that a survivor needs to kind of start rebuilding, their lives to the point where they want them to be. So like we were talking about earlier, having this a variety of partnerships and good partnerships that align with what our mission is it benefits the survivor in the long run.
And I just want to add, when people come into our shelter, they're not going to be with us forever. They might be in the shelter 60 to 90 days. They might go into supportive housing, which are apartments in the community. That could be a year, could be longer, but eventually they're not going to be in our programs. So the more that we can connect them with other community agencies, certainly they can always follow up with us, but the more, as Sam said, the more they're connected with other community agencies and the more they have a network, then there's options of where they can go and where they can get help and where they can feel supported. So the larger that network they have, frankly, the more likely they are to be successful in staying independent and staying free of the violence.
I love it, Nancy. It's that answer that you just gave, I think, kind of led me down a path of another question that I'd like to ask you. And that's really, how long do the effects of domestic violence stick with a person?
Wow, it can, of course, it varies a lot by the individual. And healing is a process. So a person who's been gone from the abuse 6 months is going to be further along in the healing than someone that left 6 days ago and is still just, I don't know who I am, I don't know what to do, I don't know where to go. But it can be a long process. And like anything else, we know that for all of us, when you're working on something, you make progress and then something happens and maybe it takes you back a step or two. We've talked about COVID-19 and how that's impacted domestic violence survivors. And we've had lots of domestic violence survivors that have been independent in the community, but maybe aren't those higher earners or have those big bank accounts. And so they may have lost employment. And does that mean they're going to lose their apartment? Does that mean they're not going to have a place to stay? And then those messages from their abuser of, see, you're worthless and you're stupid and you can't make anything work, can, they may have think they were past that, but then that pops back up in their head. And then that doubting and that anxiety and that depression that, again, they felt they were really past, start surfacing again. So that's, again, why it's so important that those resources, that those mental health resources continue to be available so that they've got someone that they can call and say, hey, I'm really struggling. Can I come in and talk to someone? Or, hey, my teenager is really scared that I'm going to go back to my abuser because we're 2 months behind on the rent. Can she come back and talk to your teen psychologist, because she really needs someone besides me to get some help from. So it's a long journey, but one thing I want to say to survivors is you're going to get there. And if you take a step back, don't worry about it, because it happens to all of us. You've come a really, really long way. You survived this. I see survivors and I think what they've been through, and I'm like, I would be a puddle of mess on the floor, and I would never be able to stand up again if I'd had to deal with that. So you're strong, you are a survivor, you've come a long way, and just keep going.
Yeah, I think what I would add is that yes, there's short terms and long term impact, and if it's untreated, whether it's an impact on mental health or an impact on physical health, we haven't even mentioned concussions and traumatic brain injuries that if untreated, there could be the impact of that on the survivor extends. So I think what I would say to survivors as well is it's okay to ask for help, and please reach out to organizations like MercyCare and PADV, because it's a lot more complex. And of course, there's sometimes a stigma against asking for help, but this is why we form partnerships and we have the services so that you can receive treatment for what you experienced.
It sounds like, and Jennifer, I do have a follow-up question for you, but it sounds like, Sam, a few minutes ago, you were talking about just the building of that support system. And I think those two questions, from hearing you guys correctly, kind of go hand in hand. Like, the reason why we have to spend so much time with survivors and rebuild that support system is because the effects and the impacts of domestic violence are typically very long-term. And you want to have people that that you can go, that are in your corner, that you can go to, 6 months down the line or a year and a half down the line. I still have people that are in my corner that I can pick up the phone and call, whether it's calling my advocate, my child advocate, or my child's advocate at PADV a year later saying, hey, this is what's going on. Or I'm picking up the phone and I'm calling MercyCare saying, I need to talk, right? Nancy, you brought up COVID-19, and that has presented some interesting challenges for us all, right? One of the questions, my next question to Brenda was, how has MercyCare what are the challenges that they've seen in this pandemic, just overall and specifically with working with survivors?
Okay, so we're starting to see more people accessing MercyCare because, we are a federally qualified healthcare center. We have an unbelievable sliding, fee scale. There's even the opportunity you may end up not paying anything, depending upon, some different factors. Mm-hmm. So many people have, as we know, lost their jobs, or many people never really had good health insurance anyway, but they've lost their health insurance. They already have chronic problems and they need their medications, or they need to continue, whether it's physical or they have, psychiatric medications. So we're seeing more substance use and substance use disorders, coming through the door. We all know that none of the liquor stores closed, and so it was available. We are seeing that, in cases with more domestic violence, we're seeing the reality of people having access, the abuser having much more access through the quarantine to the individual. So there's, less connection outside of the home, less, if I can even say, peer support, maybe other moms, less family connections. So that just means less eyes as well, on the situation. And they're coming in, and so we're hearing more about that. We're seeing some more issues with relationships because of the children. I mean, everybody is not a teacher. And then on top of that, besides children who are rambunctious or need recreation, there are children with special needs or children who have been in an abusive household, acting out. We're seeing a lot of problems coping. A lot of people have had good jobs where they built up a little savings account, a little cushion. They've been able to work extra hours, and that is not something that's within their power right now. So I would say that all of those, contribute to health problems or interrelationship issues, all the way to domestic violence. So we're seeing across the organization, and because we have MercyCare down here in Decatur, so we're in the inner city area. We have our Chambly site, which is up in Chamblee, which we really work very closely with the Hispanic population. About 95% of our staff who work there are bilingual. And we're located, at the Gateway and City of Refuge. So, we're really seeing a confluence of issues, and we're seeing it across the board.
One of the things I've heard Nancy say, a couple of things actually. I hear Nancy say a lot. We spend a lot of time together. That we as an organization have seen not only an increase in the volume of calls, but we've seen an increase in the severity of the violence, which to me absolutely blows my mind when you think about violence in and of itself being pretty severe regardless. So now we're saying we've seen an increase in that level of severity. And so that just really bothers me, and it hurts my heart, man, to think about, all the women and men and children that are living in homes right now that have violence in them. And so one of the reasons why I have appreciated doing these lives so much is because we want to reach that one survivor who may happen to pick up their phone and see, oh, PADV is live. Okay, cool. Like, yes, we're open, and yes, MercyCare is open, and yes, we're still providing services, and yes, we take your health seriously. And so if you need us, you don't have to live in those violent situations. And so, yeah, so anyway, so Nancy, I do have I think Brenda brought up children, and I want to ask you a question really directed at children. And what are the health implications for children who witness the domestic violence?
So the health implications again are very serious. We talked a little bit about for younger children, there can be developmental delays, there can be developmental regression, there can be an increase in anxiety and depression and physical health issues such as upset stomachs, inability to eat, just having more kind of negative physical symptoms, headaches, nightmares, not being able to sleep. What we see as kids get older and turn into teenagers, more acting out behavior, more aggression, more difficulty in conflict management, more likely to abuse substances, more likely to engage in risky sexual behavior. Again, more depression, more anxiety. So it's incredibly, it's incredibly damaging. It can be incredibly damaging to kids. There's been studies done on brain development and that have shown when children, as their brain is developing, if they're subjected to a lot of trauma, the centers of the brain that deal with trauma become more developed than kids who don't deal with trauma. And the development of the trauma and the crisis areas of the brain mean that when something difficult happens to that child, they're more likely to immediately respond with a trauma crisis response. So it's not just, behavioral, it's that actually their brain has grown to respond to difficult situations in a crisis conflict manner. So we absolutely need to try to remove that trauma and that crisis from our children's lives.
Nancy, you said what makes this so important is because we've been sheltered in place, we've removed those other checkpoints where other people would have seen that this kid is in trauma. So the kid doesn't have access to their teacher or their counselors or their principal or their friends' families anymore. It's just they're living in trauma by themselves. And like you said earlier, with mom who has blinders on and dad who's focused on, or the abuser who's focused elsewhere. So now we just have child that's just living in trauma with nobody really to help kind of fend or be an advocate for that kid. Am I understanding all of that the right way?
That's exactly right, Jeffrey. They've lost their support system that they had outside the home previously, and they've lost that system that would see it and that would report it, and then the Department of Family and Children's Services might get involved and be able to provide more protection to that child. So it really can build on that trauma that child's experiencing.
And
So,
you know, there's an impact here even before the child is born, because 1 in 3 pregnant women will experience domestic violence. So when you think about the impact of domestic violence on reproductive health, again, you sometimes see the violence begin or escalate when a woman becomes pregnant, and there could be some you know, there could be an impact on birth outcomes, poor pregnancy, you know, anything that the mom is experiencing, fear, anxiety, you know, the baby is experiencing as well. So there's an impact here from before, I mean, before even the child is born.
man, let me tell you, I love this, guys, because y'all, all three of you guys are just excessively knowledgeable in just everything about domestic violence, and I love it. And so I just appreciate you guys just again for sharing and bringing your wisdom to help so many people. I do want to make sure I have 2 more questions, one for Sam, one for Brenda, but I want to make sure that those who are in the comment section right now, if you do have questions or that you'd like us to answer, you drop them in there. I'm checking it, I'm reading it. More than happy to answer those questions for you before we get off the air here. But so my final question to Sam, and then I'm going to leave it to Brenda with a couple of questions before we close out. But Sam, we spoke earlier about briefly about substance abuse. And so is there a link between substance abuse and domestic violence with either the abuser or the survivor? That's a really big question. Just take it away.
Well, yeah, it's a big question, so I'll try to be as to the point as possible. But yeah, for many survivors who use substances, it's a way to cope with the traumatic effects of the abuse. So again, not knowing, you know, this is going on, this is building up. I've gone through plan A, plan B, plan C, and now this is a coping. A form of coping with the abuse. Other survivors have been coerced into substance abuse by an abusive partner. I mean, we've heard from clients who said they were forced into using drugs, they were forced into abusing substances. But there's also a lot of similarities between domestic violence and substance abuse. Both are isolating, you know, from the family. Both bring shame. Both impact mental health, emotional and physical, and there's an impact on the financial aspects of that person's lives. They both have negative impact on their self-esteem. They're both intergenerational. They're both sometimes in denial and minimization of the problem. And so there are a lot of similarities in both substance abuse and domestic violence. So oftentimes when we bring this conversation to survivors and had the similarities, even if they haven't been coping with substance abuse, it feels like they have because of all the similar impact.
Thank you. That is a really good point. And I want to, Brenda, I do have one more question, but it's really a closeout question. And I want to make sure, Ms. Jennifer Thomas just asked a question in the comment section here. So I want to see if I can read it to you guys. And any one of the 3 of you guys, please feel free to jump in and answer this question. If all 3 of you want to answer, that's also great. So Ms. Jennifer asked, how can community members help during this time of COVID to support victims and their children that may be able to leave an abusive relationship? Really great question, Jennifer. So Nancy, you want to take that one? You want me to read it again?
Yeah, I'll take it, and no, I don't need you to read it again.
Perfect.
So
okay, cool.
A couple of things. I think there's a fear that services aren't available, that we're closed. So I think just to let people know that we're not closed, that we're open, that we're providing emergency shelter, we're providing rental assistance and utility assistance, and all of that can be accessed through our hotline 404-873-1766. So don't be afraid to reach out. We are here, we are available to help. I think if you are concerned that someone may be a victim, reach out to them. They may be ashamed, they may be embarrassed. It may not be safe for them to talk about it if they're home with their perpetrator. But just to hear, I care, I'm worried about you, and you deserve to be safe. If you don't want to talk to me, call the hotline. You don't have to give your name. You don't have to want to leave. Just if you want to take that first step and call and talk to someone, you can do that. And I think just to let people know that that there is hope, that things can get better, that it's not their fault, and that it's okay to reach out and talk to somebody about it.
That's awesome. And I think, Nancy, you hit it right there. And I think the main point really that I heard was, one, pick up the phone and call and check on them. And then two, encourage them to call one of our organizations, whether it's PADV and our crisis line or MercyCare, their appointment line. Both of those numbers are pinned to the comment section. So if you need those, you can share those pretty quickly. Miss Brenda, I want to close out with you. And I ask all of our guests the same question. What's the one thing you would like to say or share to a survivor today that may be watching?
Okay. You know, in preparation for today, I just wanted to also reach out to a couple of our therapists who either receive these referrals or make the referrals. And, you know, whether it was Kristen Del Oro at City of Refuge, Walina Bryant here, Ashante Claybrooks, all of them gave me information that helped me answer this question, which is, a circumstance or a situation in your life doesn't have to define you. And that people do really want to help, that there have been many who have gone before you, and there will be people who go after you, but that help is absolutely there. And people really, really do care. They really see this as a safety issue, and that, you know, a lot of shame keeps things private, but there is a lot beyond this. And so I'm encouraging people who are in this situation, whether it is some arguing and the relationship just needs work, or all the way, you know, to the other side of the spectrum, to reach out, because people absolutely can help you.
Brenda, what a great way to close this out. We appreciate you today for joining us. I think it's been an amazing conversation. I want to point out that I keep telling people that this is supposed to only last 30 minutes, and you guys have been talking for 46 minutes and 56 seconds. This is not my fault. This is all y'all. All of you just talk too much. But this is again just been an awesome conversation. So Ms. Brenda, thank you. I know we appreciate you at PADV, and we appreciate the partnership. I hope that everybody today that watches this video kind of finds one or two nuggets that they can pull away, that they can better, either if they're a survivor, they know that our organizations are here to support them. But if they're a friend of a survivor, knowing that, hey, you can still pick up the phone and call either organization and really find out how you can best be an advocate for your friend. So Miss Brenda, Miss Nancy, oh, I forgot. Hold on. I do need to make sure that I tell people that here that they can definitely get in contact with MercyCare, and here's how. I want to make sure that we definitely share this information. So there, obviously, if you need MercyCare's information, it's right here on their website, mercyatlanta.org. You can just obviously go here, click on services, and there's a lot of resources that they have that they can use to assist you. Again, their list and litany of services are amazing, and so I just want to make sure that we definitely highlight that, as well as we make sure that we do highlight a partnership against domestic violence. And so we are here as an organization to help survivors who are in need. So you can visit our website at padv.org. All of our social channels are at PADV Atlanta. And we are here to be a resource for survivors in need. So again, Miss Brenda, Miss Nancy, Miss Sam, I appreciate all of you. And if there's anything that we can do for the audience, please let us know. We're here to serve, man. Thank you guys, and have an awesome day.
Absolutely.